My name is Mphu Ramatlapeny. I come from Lesotho. Lesotho is a landlocked country surrounded only by South Africa, and it has got one of the highest HIV/AIDS prevalences in the world, which is 23%. It's not only the high prevalence of HIV, but it has also a very high co-infectivity with TB, which is 80%. Lesotho has been decimated, the working population has been decimated by HIV and AIDS because it relied mainly on migrant labor system. Most of the Basotho men worked in the mines in South Africa, came back home and infected their families. Majority of people who have died are young, have left very, very small children. Grandmothers have had to look after many, many children who are growing. Lesotho has prevalence of 23% of HIV, and co-infectivity with TB is 80%, as I mentioned earlier. We do not have any malaria because Lesotho is one of the highest countries in the world with the highest lowest point. So it has 4 seasons, and we are right now in the throes of winter, so we wouldn't have malaria. However, we have very high maternal mortality, most of it being attributed mainly to HIV and AIDS, and high infant mortality. Before we had drugs, clearly a lot of children who were born HIV positive were all dying. But right now, we have introduced a lot of initiatives, and we are doing very well in terms of looking after the mothers who are pregnant, having children who are born HIV negative. Daily lives of communities in my country has dramatically changed. One, we have a lot of single mothers who are looking after their families, and all the single mothers also have to work. That means grandmothers are looking after families, mothers are working in the apparel industry in town. Again, the whole cycle of HIV/AIDS infection is continuing. They are being infected, again coming back home to die. However, what it has meant, having Global Fund, having PEPFAR, having other funders on the block, has meant that a lot of people have been enrolled in a very short space of time on treatment, and we have introduced innovative measures to make sure that we look after all our patients. We have introduced mother-to-child pack, which is a pack that is given to every pregnant woman when they are first present at the clinic, and this contains medication that they will take throughout the pregnancy as well as during delivery, regardless of where they deliver. We have been very smart in recognizing that because of the high infectivity, we have to treat HIV and TB as one entity. We have made treatment of HIV and TB free, available at all primary healthcare centers. We have enrolled almost everyone who wants to be enrolled on treatment to date. We are working together with the community health workers. These have been the enforcers of treatment both for HIV and TB, and we are paying these community health workers a stipend to be able to come back with the data that we need in the clinics. Before the advent of Global Fund, surely you will know that majority of countries in Africa were not able to access treatment and care. But with the aid of Global Fund, we were able to access treatment, but mainly in Lesotho, Global Fund money went towards health system strengthening. It assisted us to retain critical medical personnel, pay for the drugs of pediatric HIV patients, pay for new innovation, line probasi for the laboratory. It is paying now for the gene expert for TB. And we have been very lucky in winning almost every grant that we applied for. The biggest challenge is making sure that everyone who needs to be on treatment actually goes on treatment. And by saying this is because we want to have universal coverage of ART. We want to have herd immunity, whereby you have a number of people who are HIV positive actually covered and not being able to transmit the infection to the rest of the community, because we know science has proven that once there is herd immunity, you will infect less and less people. That's what we need to do. But most importantly is to make sure that people remain on treatment. And another issue is making sure that those who now are no longer able to use first-line drugs are actually moving on towards second-line drugs. So that is the challenge. Making sure that people remain on treatment for as long as it's possible. Those who need to pass on to the second line treatment, go on to second line treatment. Making sure that mothers who are pregnant, all of them are enrolled in PMTCT, and we don't have a single child who's born HIV positive. That is the challenge. And by having all this, we would have lowered the rates of TB, because TB, being an opportunistic infection, will not be there once people's immune system is strong. Global Fund, while has been extremely successful, but it is a very complex vehicle for delivery of finances to the countries. It has, you know that in the past 2 years it was plagued by a lot of negative press. So what needs to happen in the Global Fund is we need to be more savvy. We need to be aware of the negative press that is coming and actually counteracting that with real facts. I can tell you today that while everybody has talked about fraud in all the countries, after disbursing so much money over 10 years, Global Fund fraud has now been calculated as being less than 1%. Now, surely, even in the best banking institutions in the world, no one can come up with figures like that. So what is important is to make sure that we portray, especially we who are the implementers, we in the developing world, portray Global Fund as an important vehicle, enough to attract donors to continue putting money in it. That is what we need to do. Secondly, we need to make sure that we employ competent staff that is able to address the needs of individual countries. And also Global Fund should, developing countries, I had a meeting with them in Johannesburg 2 weeks ago. They were very clear. They do not want the round system. They want to have their strategic, they want their strategic plans of ministries to be the ones looked at once they are costed, for the Global Fund to be there to fill in the gaps where gaps are necessary. We want Global Fund to work with other funders to be able to have a comprehensive, I would say, addressing comprehensively the needs of individual countries, which will be different. We need to put everything in, all the reforms that we said we would put in, we need to put them in place. That is one thing that we need to do. We need to recruit a very good executive director and make sure that all the committees of the board work and function very harmoniously. That is what is important. And two, to portray Global Fund as a vehicle of choice for us in the developing world, for the funders to continue putting money. We need, all of us need to talk positively about the Global Fund, because the Global Fund has been fantastic in the past 10 years. I'm positive. Global Fund will remain a leader in global health, especially as a funder. The reason why I'm positive, I'll tell you, I had a meeting where we were sitting with Bill Gates, just yesterday, Bill Gates and the new president of the World Bank. None of the funders can take the place of the Global Fund. The successes of the Global Fund cannot be replicated by any funder. This I'm sure of. I've worked both on the ground as a medical doctor. I've worked with the Global Fund as the vice chair on the board, and I've been to so many countries. Every one of us will tell you that without the Global Fund money, nothing will have happened in different countries. The only thing that is needed is how to change the architecture of the Global Fund. And that is happening, and we have smart people working on this. I'm positive this is going to happen.